Hi, I'm Dr. Michael Johnson. I have a practice in Gadsden, Alabama, Dr. Michael Johnson Associates, and today I'm going to show you how I apply the Eclipse amniotic membrane to a contact lens and then apply it to patient's eye. So we have already used a topical anesthetic. We are topical anesthetic, and then we apply an antibiotic as well. And so now what we want to do is dry the corneal surface. All right, so lean back. She's already anesthetized, so we know that we're going to apply here. Make sure that we're intact. I'm blotting. I'm not disrupting any of the corneal tissue. You okay?
Mm-hmm.
Perfect. There you go. Okay, so a lot of people will, and I'm going to sit down for this. It's really kind of an easier method, especially when you want to apply a membrane, but you want to make sure that you apply it centrally, make sure there's no movement. So this is a different version. Here's one of your bandage contact lenses. Obviously, you can see whether it's correct inside out or not. So one of the easier ways that I have learned to apply my lens is I actually invert it to the inside out position. You can see that, okay, I've got it already inverted. And then I'm actually going to apply my membrane where I want it to be, okay? So you can see I've already dried it. I had it pre-positioned here and blotted it. And now I'm just going to apply this membrane right centrally for me, right here. I'm going to go ahead and use this, being very delicate. I'm going to use one of my wedges again. Go ahead and get all the folds out ahead of time. Bam. Okay, so that's positioned where I want it. No folds, no air bubbles, no defects. So that when I go, I can actually just flip the lens back where I want it to go. And it's in the correct position and it is centered. You can see it inside there. Good. And now you can kind of manipulate where you want it to go. So now lean back. Just have her look at a position. Look up, please. You okay?
Mm-hmm.
So she's looking upward. So I'm going to actually have her follow my finger. I want her right there. Keep looking at that position so that I can make sure that this contact lens is centered. Good. Membrane's in place. You can see it settle. And if you just kind of hold it there in place, you'll actually see kind of secure itself. Perfect. And I'm going to slowly, right there. Good. And if she'll just hang tight, keep her head back, try to keep her eye closed. So we have applied the contact lens into the inverted inside out contact lens. Now we're actually just going to secure and make sure that it is not dislodged or moved. So if you would put your chin right here for me, start the video for you. And you should see, I have it on a blue light because sometimes it's just easier to see it. But if you will look, there's her pupil. And of course, here's your amniotic membrane that's in place, that is behind the contact lens. And then we'll turn the regular light on now. There you go. Perfect. And that's your Eclipse lens. She's had it in for a couple minutes now, and you can see it's centered up where I want it to be. Blink. Good. No movement. And that's where I want it to be.